Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, let me tell you, I'm very happy to be here today with my guest. The topic is so interesting. It's one that I know that you will all appreciate. Coming up at our Gold Neonatal Conference 2025, if you can believe that, you can head over to the website right now at goldneonatal.com to check out all of the presentations that we have. But here today we have Mats Eriksson, who's going to be talking about the power of parental involvement in newborn pain management. And I know when you hear those words, when you're listening in, you know it's such an important topic. Working in the NICU and all the things that have transpired over the years, it's exciting to hear some of the updates from Mats, which you'll have an opportunity to listen to. But today, I would like to welcome Mats Eriksson here today as part of our Gold Neonatal Conference. Welcome, Mats.
Thank you very much.
Yeah,
Uh,
it's such a delight to have you. Not only are you with us, but we have some of your other team members also working with us right now as part of this conference and event, which is really exciting. I feel like we got the inside scoop this year from all of you and the incredible research, but you all specialize in such unique ways as well. I want to get right into this topic because I know people want to hear what's happening, the why behind this. Why are we talking about it? So let's start with, sort of the parents' point of view, and why is it important for parents to really be helping with their baby's pain in the NICU?
I think the most important reason is that the parents are the primary caregivers. They should be that. They are the ones who have given birth to the child. They're the one who will take care of the child when it gets home. And they should also be the caregiver at the hospital if the hospital can provide facilities for that.
Hmm.
Uh, but we also know that pain is bad for infants. We know that it will have consequences, but we know there are very good methods to reduce this pain, and parents can do a lot of these things to reduce pain.
Yeah,
Better
absolutely.
than the nurses and doctors who are busy with other things.
Yeah. I find it such an interesting, it seems so obvious when you ask the question, but we know that there are so many factors that play into this. I think about those parents, Mats, and sometimes they're so traumatized when they come into the NICU and they're just, whatever you can do, however you
Mhm.
do, and it might not come naturally to them. They need to be led to some of this. And so
Mhm.
that is dependent on staff, right, in the facility.
Yeah, that's depending on the culture of the unit and if you are prepared as a nurse, as a doctor to invite the parents to be part of the pain management. Of course, at day one, you will be scared by all the machines, by what's happening and so on. But we need as staff to introduce them, to tell them this is what you can do. You're important for your child. You
Mhm.
can provide breast milk if you're the mother. You can provide skin to skin, which will give comfort and uh, warmth and everything. And you can also, by doing this, provide pain relief.
Yeah, absolutely. So those are going to be the important factors, and I know that's a lot of what you've looked at in your research. So let's talk a little bit about some of those research findings that really show how parents can reduce
Mm.
newborn care pain, because this isn't just something that we think is better. This is actually in the research. So can you share a little bit about that, please?
Yeah, yes. There are many studies looking into some of these things, and there are also systematic reviews and Cochrane reviews looking into breastfeeding, overwhelming a lot of studies about the effect of breastfeeding, about skin-to-skin contact, but also the combination of skin-to-skin contact and breastfeeding, which is even more effective. There are also studies on facilitated tucking when you hold your baby together, on massage, on
Mm,
uh, swaddling, non-nutritive sucking, all these things that you can do as a parent. Some of them are effective on their own. Some needs to be combined together because uh, you can be seen as adjuvants or add-ons to the most effective ones. But in combinations, they are really effective for blood sampling, for injections, immunizations, and so on.
yeah, all those things are, as you mentioned, are in the research. So we've established we know we know that it's going to be important for the parents to be engaged. We understand the research is clear, and that continues. I know that that is a continuum for you to continue to look at the research and the newer developments. So why is it that we have these challenges in hospitals? So let's talk a little bit about that. So maybe you can just help me understand, the challenges that the hospitals might face trying to include parents in pain management.
Mm. I mean, the first challenge is, of course, society around the hospital. If they will give the parents time off from work, payment so they can actually be with their baby. And if that happens, then the hospital must provide room for them to be there. We try to work family-centered, not just because of pain, but because we know it's good for both the family and for the infant. And for that, you need facilitators. You need rooms that you can sleep, you can stay all around the clock. You need a place to make your food. You need a place maybe to wash your clothes if you're staying a long time. You need a bed. Maybe you need a place to bring in the siblings if no one can be with them at home. So it takes a lot of strategic and logistic thinking on the unit, how can we organize the unit. But it also takes a lot of culture thinking. Do
Mm,
we really allow them? Do we believe as healthcare personnel, we're the one who knows best? We're the one who can take best care of the children because we have been to university, we have learned this, we've worked here for a long time. They are just new parents, they don't know. If we have this uh, feeling ourselves, then it will be tough. We must see the
mm,
parents as, I say, the primary caregivers, the ones
yeah.
that our job is to help them be even better parents.
Yeah, there's so many layers to that. And I want to hear more from you because you said a few things and I think, is this just, it's like it seems like so big. You talked about units that have, ability to bring family in or taking care of the other children, because we often forget that some of these families have little ones at home as well, and now they have a baby in the NICU. So is this something that's happening anywhere in the world? Like, Matt's, tell me, like, have we got units like this yet? What is happening right now?
Yeah, yeah. Then I'm happy and proud to live in Sweden because here is how we try to organize neonatal intensive care. So
Mm,
every new hospital or when they rebuild the units and so on, they make like uh, the intensive care bed, uh, which then don't have to be an incubator. It could be an open space incubator, but it's mainly the parent bed instead. And then you have the ventilators, the injection equipment, and so on. But
right.
instead of being in the incubator, you be skin to skin with the parents. And
Mm,
then behind that, there's a door to the room where the parents can go and they can change. Can be the mother go to rest and the father is doing skin to skin, and then they switch and so on.
well, so it's not just a fantasy, it can happen. So
It can happen, yes.
yeah, your facilities are managing that. So this is something I guess we need to continue to advocate for, wherever we are in the world, as an international audience here. Finally, before we wrap things up here, you've been doing this for a long time, and without aging you, but I know in your bio, it talks about you being having this extended experience. So tell me, what gives you hope, really for the future, where you see, it's very clear that parent-led pain, care and management it should be as a default to the parents. So what gives you hope in all of this research?
Mm. Yeah, I think I get hope from the long experience I have. When I started to work at the NICU back in 1983, we tied up the infants in the incubator so they shouldn't take away any wires. We had
Mm,
strong light in their face so we should see them. We had
wow.
hard wires giving the CPAP or ventilator
Yeah.
so they could not move their head and so on. And then we started with NIDCAP, we started to protect them and so on. Then we came with skin to skin contact. Uh, Mothers and fathers came in. And I've seen this happening together with the technical and medical development, also the development of the care, of the
Mm,
nursing or the taking care of the parents. So now, when I started, we had 2 hours of visiting for parents. and we were happy when the parents left because then we could take care of the children again back in 1983. And I'm so
Right.
happy that that is gone. Now,
Right.
now we expect the parent to be there. Uh,
Yes. Yeah,
so,
we've
yeah.
definitely had some changes.
Mhm.
Yeah.
So my hope comes from that. Having seen this, I also believe and really trust that it will be even better. And as you will see in my lecture, things have improved a lot.
Mm.
There are areas where we don't do so good, but we're doing much better than we did 10 years ago, and we will do much better in 10 years.
Yeah, that's wonderful. Well, thank you so much for sharing that. And thank you so much for being here. Your presentation, The Power of Parental Involvement in Newborn Pain Management, over on our Gold Neonatal Conference this year for 2025. We'll look forward to hearing from you once again as part of our conference and event. And for those of you listening in today, you can head over there right now to goldneonatal.com to register for this entire event. Mats, it's been lovely having you here today. Thank you so much for being part of this event.
Thank you. Have a good
Uh,
day.
Yeah, and thank you to everyone tuning in. We'll look forward to having you back here very soon. Have a wonderful rest of your day, everyone. Bye-bye for now.